one of them is one of these matters everybody has that has to do with the cardiovascular system, the heart or heart health. Then a very one of our gender, that's the male, has a lot to do with the other aspects. Now, before we continue, this topic is actually a very interesting one, and we're going to go a bit, just go around certain matters and explain these things from basic principles in such a way that anybody will be able to understand. So as I speak, I would like us to just take note of the questions we have, so that after the presentation, we can now ask our questions and we move on. Well, my name is Lucky. Most people know me as Dr. Drugs online. And today we're going to go into the relationship between sexual dysfunction and heart health. Please, I would like us to bear in mind that before I open this slide and share, I want to appeal to everyone to try to make sure that there is nobody that is below 18 around us at the moment now, because we're going to be talking about certain things. Yes, we may say things in censored ways, but there are certain things that may be very difficult to censor. So please, in 10 seconds, kindly make sure that people below 18 are not watching, because the first part of our discussion is general, but the second part is strictly for people that are 18 and above. So let's just give 10 seconds so we can do that before I share this the slide. Yes, so with that being said, we have that's 5, 4, 3, 2, 1. Yes, so can you see my screen?
Yes, we can.
Excellent. So now I want to, yes, okay. I'm going to talk about a good amount of things. And let's start from the beginning. So slideshow from the beginning, and here we are. This is a very interesting topic, and I think everybody has to, I think we'll definitely have a lot to take home today. So we can talk about the surprising link between heart health and erectile dysfunction without understanding basic things about heart health. You would definitely agree with me. And now let's look at this from a very simple perspective. There's something that the heart and the entanglement facility, I may be speaking in code, just in case some people have some below 18 around, but just in case I sleep, let's bear in mind that we have to make sure this is for strictly adults. It's not for young people below 18. So the entanglement factor and the heart has something in common, something spectacular. And that thing is that they function with blood. You see, the heart helps to pump blood around the system, and blood also is necessary to, oh, somebody's underlining by somebody's, okay, all right. So I think at this point in time, we need to continue. So let's talk about the human heart a bit. It's a muscular organ that pumps blood through the blood vessels of the body's circulatory system. And it's about the size of a closed fist. So we're going to run through this because I think this is the basic part. The main part we're going to is where we're going to now link the relationship between the heart and erectile dysfunction. The basic job of the heart is to circulate, is to take food and oxygen to cells and also remove waste materials and carbon dioxide from them. And it achieves this by pumping blood through the circulatory system of the body. Now, before we as we move further, we will understand why I keep saying that the greatest assassins on earth are not those ones that we watch on TV, like 007 and Mission Impossible and all that, or other ones we hear about, or the people that assassinated JF Kennedy. We're talking about something that actually is within each and every member, everybody, and can actually assassinate anybody at any time. And that's why I say cholesterol deposits directly or indirectly account for most cardiovascular issues and lead to ischemia. Now, ischemia simply means cell death as a result of hindrance of blood flow. That means when the area is denied or deprived blood supply, the area after that point begins to die. But guess what? This cholesterol is one of the two assassins that finish people on earth, and its companion, stress, is also the second guy that finishes people on earth today, because stress leads to a production of reactive oxidative species of free radicals that attack DNA, which is involved in everything about the human body. Just a few issues that can come as health issues that can come about as a result of cholesterol, as a result of cardiovascular diseases, which often is as a result of stress and cholesterol. You see, coronary artery diseases, coronary heart diseases are actually as a result of often as a blockage of supply to the muscles of the heart via as a result of cholesterol deposits, blocking this blood supply and preventing effective blood and oxygen and food supply. And these cells begin to die, cause hypertension, stroke. Angina pectoris is that pain people feel in the middle of their chest or discomfort that radiates sometimes to the neck and to the left arm because of the cells of the heart are crying out and saying that they're having low amount of food and oxygen. That pain is referred from the heart. And then we don't understand that rheumatoid arthritis actually is, apart from the inflammation and issues it causes on the foot, it also has issues in the heart. Cardiomyopathy can just simply means, in Latin, it just simply means heart muscle problem, you know. So it can be enlarged. We say it's hypertrophic. It can be distended, like in case of dilated cardiomyopathy. We say that it is. We also have the one that affects a lot of people, especially our females, because females are often emotional and tender and should be treated in a very fragile and gentle way. But sometimes when the chips are down, you have what is called deep emotional trauma that can lead to what is called heartbreak syndrome, which is sudden enlargement of the heart due to emotional stress or physical stress. And it's also called Takotsubo syndrome. Then we have cardiac arrhythmias because the DJ that regulates the heartbeat also needs food and oxygen to continue its function. And when it is deprived of this as a result of cholesterol blockage, you find out that it begins to starve, and you find out that the DJ that regulates the heartbeat, the locked up heartbeats we normally hear, goes haywire, and the heart begins to beat irregularly. Then we have congestive heart failure, which is as a result of poor heart function from the word failure. The heart is already failing in its duties to pump, especially to pump blood around the circulatory system. Then we have inflamed heart, carditis, peripheral artery disease, which means the problem we're talking about in the heart, where cholesterol is blocking blood vessels that are supplying the muscles of the heart, is not happening every other place of the body except in the heart, and that's called peripheral artery disease, because the other parts of the body also need food and oxygen supply from the blood as well. Now we have venous thrombosis. This is what happens when people in airplanes sit down for too long, maybe traveling from Nigeria to India, they don't stand up. And when they get to India and stand up, they fall down. And somebody thinks there is somebody in the village that's actually causing this problem. It is not a village problem, but cholesterol has accumulated at the back of the leg as a result of the long sitting position. And when the person stands up, a bit of it breaks off and can lodge in the lungs. And if the person is very unfortunate, it can lodge in the brain and then the person falls down and needs to be taken to the hospital. So it's also called a traveling. Also, it's also called an embolism, which is I just say it's a traveling. It can cause what is called a traveling cholesterol blockage. Just for simple explanation. So these are the few things that these are just a few of the things that examples of cardiovascular diseases, and are mostly and oftentimes caused by cholesterol blockage. This is how it happens here. It's basically, you can see the cholesterol accumulating here, causing inflammatory processes that allow other cholesterol compadres to come together and begin to block the blood vessel. And the other side of the blood vessel begins to suffer, and the cells on this other side begin to die and cry out and cause a lot of discomfort, etc., etc. Now, this also has just a depiction of myocardial infarction and how it leads to angina pectoris, and we can see sudden cardiac death or cardiac arrest and a whole lot of others. But bear in mind that angina pectoris is more dangerous when it is unstable, because in that case, the heart, the pain in the chest can come up while the person is busy relaxing and is not supposed to have any, is not having much activity, as opposed to stable angina, which often happens when the person indulges in stressful activity or certain stressful activity. As you can see, this guy here is what we call an orobo. He had just climbed just a few stairs and is already holding his chest because his heart cannot take it anymore. So you can see that is why it's very important that we quickly consult our health practitioners to make sure that that mild pain in the middle of the chest is actually not something that is deadly. Now, symptoms of coronary artery disease include shortness of breath. Yes, actually, your heartbeat and your breathing are very connected, especially around the area of the medulla oblongata of the brain. Then we have extreme tiredness and fatigue. Imagine the heart can't pump enough blood properly. Where do you think the muscles are going to have energy from? Insomnia, anxiety, irregular heartbeat, as aforementioned, dizziness, sweating, nausea, burning, pain or pressure in the chest, upper abdomen, and all that can also be signs of coronary artery disease or poor heart health. The risk factors include hypertension, diabetes, lack of exercise, obesity, because your heart will need more energy, more pressure to pump and supply the extra mass that one has accumulated. And that could be very stressful and detrimental to the heart. Can actually lead to cardiovascular issues, genetic predisposition. Yes, some people say that their mother and their father are fat and everybody is big in their family, but that is not a license to actually be overweight, because it simply means that one has forgotten that lifestyle, lifestyle changes and lifestyle adjustments can help us to elude or avoid genetic predisposition. Smoking is terrible, as it can double the risk of coronary artery diseases by 2. Alcoholism, of course, produces bad cholesterol directly. Let's bear in mind that having been overweight predisposes our females to issues like endometriosis and rheumatoid and arthritis as well. It is cardiopulmonary resuscitation is simply how to make sure that the brain, which is a very powerful organ, is receiving blood supply even when someone is having a cardiac arrest. And this is how we go about it. We'll talk about this some other time. Hypertension is a sustained elevation of blood pressure above normal. I just want to talk a bit about hypertension because it's very, very common. Because this is not where we're going to dwell today. And we've talked about hypertension extensively in the past. But it's very important because there's a very strong link between this particular issue and heart health, because it's very common, and you find out that about 80 million people are having it, and only about 26.7 million people are aware that they're hypertensive as at when the research was conducted. This is how we know what blood pressure. This is, if you just know this formula here, you have turned to a mini cardiologist, because this is all the story, the long and short. You have to know about hypertension. The medication that they're taking are all targeted at this simple formula here. And the way hypertension originates is also based on this simple formula here. What it means is that the amount of blood the heart pumps per unit time multiplied by the hindrance to such a flow is simply blood pressure. That means an increase in the amount of blood supply to the body, the rate at which the heart pumps blood to the body will definitely lead to an increase in blood pressure from this formula here. And also, an increase in the resistance to flow will make the heart to increase, to have a compensatory increase to overcome such a resistance. And that is why people often have high blood pressure or hypertension when this process is sustained. And that is basically the long and short of the story that has to do with hypertension from this basic formula here. Now, this is where we are going to, as you can see, this cholesterol blockage here. Let's take a very close look at this. Has to make the heart pump with a higher pressure to squeeze the blood through here, as opposed to this area here. Definitely, if this plaque is removed or this cholesterol deposits that as a result of the things we eat and our lifestyles, that should actually help the heart to pump blood with less resistance, and that in turn leads to a reduction in blood pressure. This is the secret in reversal of about 90% of cases of hypertension. If you clean up your blood vessels of all this, you find out that your blood pressure begins to go down. The testimonies in my phone and in my records are so numerous that if you're a hair practitioner, you have to consider cleaning the blood vessels of this to help the heart pump with a lower pressure. So we have two types, primary and secondary. The factors, these primary factors are no known particular reason. What you can say, we suspect it is genetics, we suspect it is this, we suspect it is that, but scientists have finally found out that about 90% of these cases are actually a result of cholesterol blockage. But it happens in about 95% of cases, and that means most people that have hypertension have this type of hypertension. Unfortunately, this woman is sentencing her baby to hypertension without knowing, and lack of breastfeeding can also sentence babies to hypertension as well. Hypertension or secondary hypertension, which is second type we're talking about, is that as a result of known cause. A typical example, if somebody is having hypertension as a result of financial distress, if you give that person about 10 million naira for no reason, you find out that there and there, as the person is saying, praise the Lord, the blood pressure begins to go down. That means we know that the reason why a person is having hypertension is because of financial distress, and we have given the person 10 million naira, and the person is already happy, and the BP begins to go down. So once you find the reason why, once you reverse the reason why this type of hypertension is occurring, you find out that the BP begins to go down instantly. Pregnancy-induced hypertension is as a result of pregnancy and often reverses after childbirth. But we still have hypertensive crisis, which is dependent on whether there's end organ damage like eye damage or a stroke or a heart attack and all that. Or whether there is no organ damage, but the BP is actually above 180 over 120. Let's bear in mind that the normal blood pressure is actually a range which is about 100 to 130 over 60 to 80. And let's not be so scared when we see 121 over 82 or something like that, and they say your blood pressure is high, because that worry itself can actually lead to a high blood pressure. So let's just take it easy and understand that it's actually a range, and we should target our blood pressure within that range. Isolated hypertension is just hypertension that seems as if the upper and lower values are having a quarrel, and that leads to a lot of complications. Now, it's a silent killer, as we know, but if you want to have pity on people, it gives certain symptoms like headache at the back of the head, especially in the morning, lightheadedness, altered vision, fainting episodes. Imagine somebody fainting up to 4 or 5 times from the house to the market and back to the kitchen, and after cooking and the dining table is fainting again. Such a person should be rushed to the hospital and the blood pressure should be taken. Now, the reason why I said it's called a silent killer is because people don't really know when it occurs, and sometimes people sleep and don't wake up, and they find out that the person may be gone by in the morning, and you see People say that is their uncle in the village that is struggling for land with them, but unfortunately, it's hypertension that actually committed this murder. This is how we measure blood pressure. It's with a manometer and nothing else. No matter the way it comes, be it digital, be it air, be it whatever, this is what we need to measure blood pressure and help us to monitor our blood pressure. You see, this cat here is a typical example of what people that most likely have blood pressure would look like: obesity, smoking, alcoholism, poor dieting, drug abuse, kidney disease, amongst others. Now, professional management is simply avoiding the avoidable risk factors, and you have to monitor blood pressure regularly, because some people will feel that they can know their blood pressure by the way they feel. It's not true. You can be feeling as if your blood pressure is high, and if you measure it, you find out that it's normal, and vice versa. Avoid salt intake, because anywhere salt goes, water goes. That means if the salt goes into the bloodstream, water will follow and make the area tight or increase the pressure within the blood vessels. And from what I've just said, you know that the blood pressure will be high as a result of higher blood volume within the same blood vessel or space that was pre-provided. Of course, we should have a healthy diet. Example is Mediterranean diet. Body mass index as well has to be within 18.5 to 24.9 kilograms per meter square. Reduce alcohol intake, quit smoking, and then use of appropriate medication. That's to take people out of danger, as well as use of supplement or natural pharmaceuticals to help reverse this issue from a cellular level. This is what a Mediterranean diet looks like. All things bright and beautiful. You won't find any of those risk factors, like there's no Benson here, no Semoris, there's no XO, no Ace of Spade, and there's no Martel, there's no Centremi, and all these things that can lead to issues. But you see, all things bright and beautiful means we eat healthy and stay healthy. So this is just a basic statistic of what hypertension is. Imagine 80 million people knowing about having been hypertensive, and only 26.7 million people are aware. Please tell me what is happening to those 53.3 million people. They are virtually like walking dead, because they can drop anytime and begin to point accusing finger to the wrong people, but without doing this hypertension that's causing the problem. So the complications include eye problems, stroke, amongst other issues. And this is just a typical depiction of what hypertension can do. But this time around, we're talking about what it can do in the eyes, because as blood pressure rises, it damages the inner wall of the blood vessels, causing inflammatory reactions that lead to accumulation of cholesterol and other factors in the blood vessels of the heart, leading to cardiovascular complications. But bear in mind that when this same damage of blood vessels where hypertension happens in the eye is called hypertensive retinopathy. Well, in terms of diabetes leads to an increase in bad cholesterol level that leads to cholesterol blockage of blood vessels. And of course, the eyes also need blood supply. And that's how people have what is called, and the eye also needs blood supply. But bear in mind that it can also lead to cardiovascular disease via this process. But let's remember that the eyes also need blood supply. So if it blocks the blood supply to the eye as well, one may also have what is called diabetic retinopathy, as is seen here. But in this case, if it happens in the heart and other parts of the body that are connected to the blood, you can see that it causes cardiovascular disease. This is just on the side, and just to educate us a bit, so can mind a way, just a little digression to what can happen as a result of diabetes. Now, this is a very, very important section, and this is where we're going to now have a strong link between erectile dysfunction and heart issues. So, sexual dysfunction is defined as a state of physical, emotional, mental, and social well-being in relation to sexual health, in relation to sexuality. Anything that derails from this aspect has already started pointing us towards sexual dysfunction. So for good sexual health to be attainable, one must have a healthy reproductive system, have no sexual dysfunction, have no entanglement facility dysfunction, have no infertility issues associated with low or no entanglement materials, that's sperm or egg, have no tumors or growth in the reproductive area, of course, no disease or infection like pelvic inflammatory disease, have good body mass index, have no drug addiction. For example, alcohol, a lot of us don't know that alcohol is actually a drug. Have a healthy hormonal system, of course, have a healthy cardiovascular system, and have no mood disorder like depression, anxiety, etc. So let's bear in mind that a man must work and work well after working for things to work. I believe this is very easy to understand. I'll repeat one more time. A man must work and work well after working for things to work. That means even though you are a man, when you finish working, you must have to go back home and work again for things to work. Amen? So now, erectile dysfunction, the recurrent inability to achieve or sustain penile turgidity during sexual activity to permit sexual satisfaction. In other words, it means it's the inability to achieve or attain an erection long enough to have sexual satisfaction. When this happens over a long period of time, one is known to be having erectile dysfunction. But let's bear in mind that a stitch in time saves 9. And many men with erectile dysfunction do not seek treatment due to embarrassment, which does not even help the situation. When they're having a problem, they keep quiet and nurse it, and that is actually very terrible. But we'll find out more about this, and we'll know why a lot of men do that. So the symptoms is very simple and straightforward. Little, brief, or no erection. That is a symptom of erectile dysfunction. What are the causes and risk factors? High blood cholesterol, and this is where we are going to. High blood cholesterol, that was the same culprit that was causing the problem with the heart, is now here again causing problem with the entanglement facility. And this definitely will not make the owner of the entanglement arena happy. So you can see that diabetes via diabetic retinopathy, of course, can affect the nerves that supply that area. Cardiovascular disease, of course, as aforementioned, obesity, which highly predisposes people to high blood cholesterol, of course, and a lot of other things, prostate health issues, and when they have actually had surgeries on the prostate, smoking via arterial narrowing. Let's bear in mind that the blood vessels that supply the entanglement facility already are very, very narrow. So you can imagine what will happen when cholesterol goes in there. Trauma to the spinal cord can affect nerve supply to that area. Aging, of course, as people get older. I'm not talking about getting older in numbers, but I'm talking about getting older in biologically getting older. That's what I'm talking about. Alcoholism as well, stress, psychological issues, infection, etc. Now, as you can see, this man, look at the face of this woman on the bed. It's the typical face of the owner of an entanglement arena is not happy because the entanglement factor or the entanglement facility of the owner of the entanglement facility is not having a very high entanglement factor, and entanglement cannot take place. Now, this leads to a lot of issues, which includes low self-esteem. You find some men, when they're in a place where they're supposed to talk, their voice is very low. It's because their wife has told them the life history of their life history as a result of their inability to perform. Fear of marriage and relationship as a result of fear of sex or entanglement is a very common issue that happens because people do not want to go and put themselves. You cannot go to war with a wooden gun. You can't go to battle with a wooden knife. You can't go to war with a wooden gun. So you see, they begin to shy away and avoid such encounters. Divorce is almost sure when a man is supposed to perform and is not performing well. In fact, the probability of divorce is so high, is even higher than when a man is poor. So it's better to take care of that. Then depression and unhappiness. That tells that the man is already having low self-esteem. The woman is unhappy, as can be seen in this picture here. Of course, poor sexual performance. But let's note that psychological impotence occurs in about 10% of erectile dysfunction cases caused by thoughts or feelings. When men with impotence are locked or are mocked or teased by their partners, they can worsen the situation. You can see a woman, if the man just says, let him just, as he's putting on his tie and he stretches his hard, he said, look how you're stretching your tie hard, but you could not perform last night. Anything the man does, the woman begins to mock. That can lead to what's called psychological impotence. And it can mean that anytime the man wants to entangle, he begins to become overexcited and begins to wonder, how well am I going to perform? How well is he going to perform today? What's going to happen today? Going to, arrive at his destination before time and all that, and all these things can lead to excitement and worsen the situation. So ladies, be cool when you are addressing this issue with your men. Now, the process of erection is simple. Engorgement of the tissue of the entanglement facility with blood through the blood vessels that supply it. That's basically what it is. As you can see, how it starts when maybe before entanglement, and then after the rewards of entanglement, you see it goes back to where it came from. This is how cholesterol blocks blood supply to the entanglement facility and makes it next to impossible for people to achieve or attain a very sound entanglement factor. And this can actually have issues, actually making the owner of the entanglement arena very unhappy. This is of very important note, because this is exactly what happens when there's blocking the heart. That is where we're having a very strong link between that's the common link between heart health and erectile dysfunction. So that you can see that what affects the heart can actually affect the entanglement facility. So you see cholesterol blockage or deposit in the blood vessels that supply the penis, the entanglement facility, leads to failure of the shaft achieving or sustaining erection long enough for sexual satisfaction, as is found in the cholesterol removal of this blockage, is key in reversal of cardiovascular issues and erectile dysfunction. That means once you remove this cholesterol, you see that you're actually helping both your heart and your entanglement facility. So this is how natural pharmaceuticals help us to attain and maintain sexual health, to improve sexual appetite and performance, or reverse hormonal imbalance, prevent past cardiovascular issues. They help in mood disorders, because of course, you know that especially females are very strongly tied with their emotion. So when a woman is not in that mood, brother and sister in the Lord, just create the kind of war that Israel created between themselves and Gaza, because she may not find it funny when you try to come close to her entanglement arena. Prevent and manage reproductive disease and conditions, of course. Prevent and manage infertility issues. Help take care of hormonal imbalance and help appearance. And because you know that men are moved by what they see, and you know that women are moved by what they hear and what they feel. Of course, weight management, because being overweight is an automatic sentence toward erectile dysfunction. So just a few examples of natural pharmaceuticals or nutraceuticals. An example is Arctic Sea. It helps to what? Disperse cholesterol aggregation. That's cholesterol and its cohorts coming together to block the blood vessel, because it contains eicosapentaenoic acid and docosahexaenoic acid. And these are essential fatty acids that can actually help to what? Disperse this aggregation and allow for better blood flow to the heart as well as to the entanglement facility. Garlic thyme contains lecithin, and what it does to fat or cholesterol deposit is what Omo does to engine oil, shikenan. That's just what it means. So when you take garlic thyme and the lecithin, it helps to what? Also clean up the blood vessels and allow the blood to flow. And allowing blood to flow to the heart, allowing blood to flow to the entanglement facility is also very essential to reversing this issue. So we've talked about this, the connection between both of them. We've talked about cholesterol being the common factor between both of them. And we're now talking about how we can remove this cholesterol from the system. And you can see aloe vera gel, this drug, this natural pharmaceutical is something that, in fact, we'll start talking about it today. We'll not finish talking about it because it's, in fact, its uses are numerously numerous. Let's just talk about a few. It also has very powerful anti-inflammatory properties that prevent that aggregation. In fact, it also helps to prevent that in the brain, and that causes stroke. Now, cardio health is unique in the sense that it reduces cholesterol directly because it contains coenzyme Q10. And that is where we're going to talk about. Though it helps to rejuvenate and regenerate the heart, the lungs, the liver, and kidneys. But in regards to what we're talking about today, it helps to reduce cholesterol very well and allows the inner wall of the blood vessels to be so smooth so blood can slide freely and hence help. And that also prevents cholesterol having anchor points in the blood vessels where they start blocking, where they cannot start blocking those blood vessels in future. This Ag Plus contains a unique amino acid called L-arginine. This amino acid leads to the production of what is called nitric oxide, and that's a powerful natural vasodilator. You see, when the expressway that blood used to supply the entanglement factor was a single lane, and then maybe the federal government comes and makes it a double lane, you see that there's easier flow of traffic or blood, and that helps the entanglement facility to have a higher entanglement factor. Now, it also helps in cachexia, that helps muscle growth. And as you can see, and that's the way it happens in the downstream sector is also the way it happens in the heart area and helps the heart to cells and tissue to receive more oxygen and blood supply because it will make the blood vessels in the heart to be more perfused, and that can relieve that angina pectoris people feel in the middle of their chest, in their neck, their hand, and all that. So this will assist to can also assist to do that. Vitalized Men, of course, contains, in fact, from the name Vitalized Men, you see that from the time of his baptism, they had men in mind because he has a lot of things there that helps with male sexual reproductive function. Multi-marker is the sex herb of the Incas, and it basically rearranges everything, everywhere, in every way, in short. Because if we're going to talk about the phytochemicals involved in this, we may not live here today, but that is just the basic work of what it helps to even reverse sexual dysfunction or hormonal imbalance that leads to sexual dysfunction. This is aloe gel again, because it also helps to reverse and prevent and shrink benign prostatic hyperplasia that can actually lead to erectile dysfunction, especially when people undergo surgery in regards to that. And you can see that's why I just quickly brought it there again, so we don't forget. Well, Bipolin helps to nourish the sexual reproductive area generally, and Immune Blend helps to prevent infection, because you can imagine someone that has an infected entanglement facility. You find out that it will not function properly until that pain or that funny sensation that is going on there has actually been removed. So it helps to boost the immune system as well to help with regards to that. This is the fountain of youth. Anything that has to do with taking you back to the way you're supposed to be, in fact, in Nigeria, that's what we call follow-come. Anything that will help you go back to your follow-come, this will help you achieve it. And it also, as a bonus, helps to prevent breast flaccidity. So because it makes the cells to be more turgid and healthy, and that's why women love using it, as well as it helps to make people younger and also fresher, amongst a lot of other things it does. B-propolis is a powerful antimicrobial agent that helps to fight against infection. And we all know that if an unhealthy entanglement facility is an unhappy entanglement facility. Weight management is very important because having overweight is like sentencing oneself to having erectile dysfunction, and that can lead to a lower entanglement factor. So you can see that these are natural pharmaceuticals, like hydroxytric acid hinders the conversion of carbohydrate to fat. We have TEM for thermogenesis, to burn off fat or cholesterol from each and every cell of the body and convert it to energy. We have chromium trichloride that helps to metabolize fat, carbohydrates, and also helps in turn fat deposits in the body. And also we have C9, which is a 9 days weight loss and detoxification program, which includes dieting, exercise, professional fasting, and a lot of other things that can help to make us achieve professional weight management, because there's a difference between weight management or weight loss and malnourishment or malnutrition. They are different. People go and take stuff that make them malnourished and they slim down and they're not looking like a scarecrow and they say that they have successfully reduced weight. Such a person is unhealthy. We have to reduce weight and also remain fresh and nourished. And that's what C9 does for us. Yes. So you are what you consume, and there's a constant battle between factors that repair and protect our bodies and those that break it down. So we have to be on what? The winning side. Thank you very much, and God bless.
Wow, this is amazing. Thank you so much. We'll take questions and answers now. You did justice to it completely, and we are grateful, very grateful. I wasn't expecting anything less, though. So can we take questions? Can we all celebrate our Dr. Drug for this wonderful presentation? And if you have questions, please ask. Yes, very amazing and interesting.
Okay. I guess that we don't have any questions. So, okay, thank God, thank God, thank God. I can see a lot of people saying, thank you. We thank God. So, this is just a very simplified explanation, so that we can all understand. I use some certain terminologies that can also help us to, reduce the level of explicitness that is usually involved in this. And I have aforementioned that this presentation should be for 18 and above. And also, let us bear in mind that we don't claim that you should actually use this as a replacement for whatever your health caregiver has given to you, but usually used as a support and used to help to resolve matters. People are actually going back to nature, because I've had cases of erectile dysfunction or ED that these people, when they come around, I first of all give them rules and regulation. I also want us to understand something that I did not put here. I didn't put this here intentionally because I wouldn't want to seem as if I have anything against the manufacturers of these products. You see, some of us find out that you see on the news, you find out that a young lady will just be paraded by the police, and there will be a man dead on the bed in the hotel because the man has tried to improve his entanglement factor with certain drugs. You see, the relationship between the downstream sector and the heart is actually very close. That means when you take something for down there, it also has effect on the heart. That is why when they are having their entanglement, the owner of the entanglement arena is shocked when the person begins to shout, oh my God, and the person finds himself in front of his maker because he's dead. And you see, and that's because the heart has given up as a result of the stress involved and the toxins that are in these products that people take. So be aware that these products are actually toxic. They are toxic, and you will need higher and higher doses of these products. That is the truth. Because if you use a tablet of, for instance, a chemical drug like sildenafil citrate, you see that by the next week or upper week, you may need 1.5. Before you know it, you're using 3, 4. Before you know it, you're packing it, you're teaching in the mouth. And guess where it's also affecting, apart from the downstream sector? The heart. So during entanglement, you can find out that the owner of the entanglement facility can just collapse and fall on top of the owner of the entanglement arena. So we have to be very careful when we make our choices. And that's why you see these natural pharmaceuticals are better. They may be slow, but they'll begin to arrange the system from a cellular level. And that's what we're searching for. Yes. So that was just on the side note. So, oh, someone says that we should talk more about the ED drug. Okay. 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 These are not okay. So we'll talk about the ED. Let's see ED drugs. The drug for ED. These are natural pharmaceuticals. They are not drugs. They don't have side effects like drugs. They don't work like drugs. You know, you can take a drug to a chemical drug to enhance entanglement factor, and you find out that in the space of 1 or 2 hours, it begins to function. But trust me, the person is actually killing the entanglement facility completely. It's better you are patient and allow your body to clean off all those materials that have been taken to boost entanglement factor from the system, and then let healing begin from the cellular level so that people can be in their follow-come state. You understand? You can get back to your follow-come state, and that's just what it is. So if one is actually taking these things, please stop it first and check, because if someone has undergone surgery and there's already damage to that area, you don't waste your time. Don't waste your time taking those stuff because it will not work. Just be patient and allow your body to heal. And if you're fortunate, you may have some connection. And when that connection begins to come up, you will find out that it will continue to improve until you now begin to have a high or good entanglement factor. Thank God, thank God, thank God, yeah. So let's just talk about the natural ones that I aforementioned. Remember, just go get across to whomever invited you, and the person will give you everything that you need, okay? So that you don't go backwards. Thank you. Okay, you're welcome. Thank God. Okay, thank God. Well, you see, bitter cola, Garcinia cola is actually very nice. You understand? Because it contains a lot of natural compounds that help to improve and prolong life in general. So you can see that your entanglement factor is part of your life. So that basically explains that. Okay, so let's not go into the ingredients or natural substances that are found in bitter cola. But rather than go for something that works indirectly, why don't you go for multi-marker, or you go for Ag Plus that will improve the highway with which blood reaches the downstream sector and improve performance, or you go for something like Royal Jelly, Vitalized Men is there, and a lot of other of these natural pharmaceuticals, and then save yourself the stress. Alligator pepper, this person sounds like, I hope you're not a native doctor. So I'm just kidding. Anyway, so just these things are good for the body generally, you know, and so that's just indirectly, you know, just like someone, even if someone is malnourished, the entanglement factor drops. So even if you eat good food, your entanglement factor improves. So that's just it. Yes, so that's Mr. Asian. All right. Can you recommend natural fruits that can help reduce cholesterol in the blood? That is a different topic. But there's no need for you to go into the bush and start searching for natural fruits when you have these extracts that have been carefully and micronized in such a way that your body can absorb them wonderfully well, and without the use of application of heat. For instance, looking for fruits when you have aloe gel that we know that even the Egyptians have been using for thousands of years to regenerate and rejuvenate themselves. I don't think it's necessary. Why don't you just get across to invited? And you see, they will show you wonderful things that okay, for instance, the Ag Plus you're talking about, these are natural, it has natural extracts in there. If you check the pack, you see a myriad of things, natural fruits that are there. Why do you have to go to the bush and start searching for such things? Where will you find pomegranate in Nigeria? It's there. So these are the things that we should look at. So we have a lot of things that can actually be used, but they're already packaged, well packaged in these natural pharmaceuticals provided by Forever Living products. Okay? So you don't have to go into the bush and start searching for fruits. Okay, Mr. Emma Muzo. Okay? Yeah. Oh, thank you very much. Thank God. Yes, you can. You can actually take multi-marker and cardio health. Yes, you can. Doesn't mean your body will take what it needs. Okay, don't worry. There's no contraindication in that. The coenzyme Q10 will not be too high. Okay, thanks, Bright, for that amazing observation. Thank you. Thank you. Thank you. Okay, Dr. Steve Uzodima, I really appreciate. Thank you very much for that wonderful comment. So, in the absence of any other question, I think at this point in time, we can say now the day is over. Okay, who else? Okay, thank you too. So, thank you very much from here, and good night, and God bless you. Bye.